Thank you. And let me yet again say thank you to Structure House for the sponsorship, and thank you for the help of my team for making me look good tonight. I appreciate that. I'm just the talent, but I need everybody else to make me look good. A little bit about me. So Dr. Todd Giardina, I'm a licensed psychologist. What I do is provide psychotherapy and coaching to women and couples. And my focus is from a holistic perspective. I think it's important that we see the person or the relationship in a more holistic way, not from just one point of view. And that's what we're going to be talking about here tonight, trying to help you have a better sense of holistic self-assessment and self-image. So let me get this out of the way first. I love you. I love all of you. I mean, no, I don't love all of you. I love all of you, and I love all of you, and I love all of you. And that's what we're trying to get to here. The holistic self-view, the part where I think a lot of people get stuck, is that there's some part of ourselves that we don't honor, we don't accept, we don't appreciate, we try to reject. And I call this your gap. There was a sitcom that I liked a few years ago, and the phrase was, what is your gap in knowledge? And they teased different characters that certain people on the show had this gap in knowledge. One of the main characters got teased because he was a brilliant architect, but he couldn't pronounce one silly, simple word. And so it was funny to tease this person because the idea was that these characters, these friends, these people in his life loved him, appreciated him wholly, so this gap in his knowledge wasn't that big a deal. I can look past the gap. And I think our family or friends can do that, but the struggle is to do that for ourselves. And the challenge for a lot of people in this room is to make sure that your patients or clients can see their gaps, not just in knowledge, but in yourself, your self-image, and then accept it, own it. Don't run away from it. Don't pretend it's not there. Don't let that be the thing that takes away from an overall sense of self-love and appreciation. So now let me get this out of the way. I do not look like Joe Manganiello. You might have noticed. If you're not familiar with Joe Manganiello, he is this beautiful, stunning Greek god of a man, famous for the vampire True Blood and Magic Mike. Also of note, he has this terrible relationship with a person called Sofia Vergara that he has to suffer through. I am not Joe Manganiello. And I kind of wish I was. And there's times after a workout when I look in the mirror and I'm waiting to look and I don't look like Joe Manganiello. My staff can tell you later, I tried to grow a beard and it was a little salt and peppered. I'm like, sort of Joe It's not Joe Manganiello. This is not Joe Manganiello. But you know what? I know that. And that's an asset, especially here tonight. If I look like Joe Manganiello, nobody's listening. You're all waiting for me to shut up and take my shirt off. And that's nice, but that's not what I want from you. That's not what I'm trying to do here. So by virtue of me not being the thing that I want, by me having this gap in my self-image, I know it, and I can use it, and I can play to it. I mean, I'm not a terrible looking guy. Like I'm attractive enough that you'll tell me about your sex life, but you're not going to think about having sex with me. So that's good enough. So it works. I truly believe in my heart of hearts that if I look like Joe Manganiello, I wouldn't be a nice guy because I could be Joe Manganiello. I could just say something rude and take my shirt off and know all is forgiven. I have become the guy I am, both as a professional and as a person, because I don't look like Joe Manganiello. I think that my male patients have treated me differently because they don't need to be macho, because I'm not Joe Manganiello. I'm this little guy. Look at me. Come on. What's the big deal? You're more manly than me. You can cry in front of me. It's okay. I think that if I was Joe Manganiello, I probably would be an actor or model or male stripper or whatever and not have ended up with a PhD in psychology. So because I have this gap, I have this thing that I am not fully pleased with. It's not exactly what I would want to be. It makes me who I am. And that's where I think we struggle. As an individual, if you're honest with yourself, if you had everything you wanted, or if you were everything you wanted to be, you wouldn't be you, and you wouldn't be you. You'd be some other thing that you think is better, but maybe it's not. And even if it is better, it's not you. It's a whole other life. So what we want to get to is owning our gaps, owning the gaps that our patients see or maybe don't see in themselves. And what we're really talking about here from a clinical perspective is reframing, right? Cognitive restructuring. Give it whatever label you want. But it's seeing the silver lining, seeing the glass half full, recognizing, but seeing you as you are, seeing yourself as you are, then you can play to your strengths, and sometimes your gaps are strengths. What we're also talking about here, though, is that there's something more likable in a person who's not perfect. There's been studies that show that even something like dropping your papers during a speech can make you more likable because the crowd sees that you're not perfect. So you want to be skilled in whatever area you're focused on. Whatever you're selling, you better know what you're selling. But nobody likes the guy or gal that's perfect. We secretly resent them. We feel like they're up to something. We don't buy it. Because it's not real. Because guess what, ladies? Nobody's perfect, and we know that because we know we're not perfect. So if you're trying to sell me perfect, already I'm looking at you a little askance. I'm kind of wondering, like, why aren't you real? And we like real. We like genuine. If you think about the relationships, people who you're close to, you know them, and you know them, as the Bard would say, like warts and all, right? And that's part of what you know and love about them. That's what makes it a special relationship. The superficial is the perfect, but once you go deeper, then, well, now you're not perfect, but now I know you. I know the real you, and I get to love and appreciate and accept the real you, right? So, I love my wife. Let me get that out of the way. But one time, she sat me down after many years together and saw me trying to be perfect and aspiring to be. Joe Manganiello wasn't the pursuit then, but it was other stuff. There was always something that I wanted to be perfect. More of this or less of this or more perfect this. And she kind of like grabbed me by the shoulders and like said, "You're short and you this and you that." And she listed all the things that make me not perfect. And it was really kind of hurtful, and I got a little like upset by it, and we had a tough moment there. But what she was trying to do is say, A, I love you with all that. So stop. So recognize you're not doing it for me. Let's not pretend that this is something I asked for. But B, by seeing your imperfections, by owning your gaps, it takes the pressure off. Like you're already, oh well, like you're not perfect, so give up. Because even if you had X, Y, and Z, you still don't have W. So you're not perfect. So stop trying. And when you stop trying, it's just easy. It's so much easier. It's just comfortable. But it takes that first step of saying, I have this gap. I have this thing that I don't like about myself, and I need to make peace with it and see that it's there. So I'm very clear in my not Joe Manganiello-ness, okay? But let me tell you a story. I'm going to tell you a few stories. But I have this patient I'm treating, and she is young, she is attractive, she's an aspiring model, she is a size 0 to 2. She has a very large chest. And that's essential to the story. And so she comes in after a few sessions, and she's telling me how it's like borderline paranoia. There's this anxiety. People are looking at me. I feel like people are judging me. I feel like on the way over to your office, doctor, I felt people's eyes on me, and I think they were, and she listed all the things that they were thinking. And I said, blank, you're wearing a see-through white shirt. They're looking at your boobs. And she was shocked, and I'm like, look, I'm not trying to be inappropriate or make you uncomfortable, but how are you not seeing this? This is the thing. And maybe there's other things, and we've since then deepened into the self-exploration. But it started right there with her having this very obvious physical trait that is probably what people are looking at, and she's jumping to all these other things. And there's this lack of self-awareness. And I think with self-awareness, then you can decide what you want to do. Do you want to act on something? Do you want to change something? Do you want to accept something? But it starts with knowing yourself and not pretending you don't know. The more colloquial example that everybody knows is the marriage where somebody's been eating the meatloaf for 10 years and then the guest comes over and says, this meatloaf is too whatever. And then the spouse finally goes, yeah, I don't like your meatloaf. And like, how do you not know that you're a bad cook? You've been pretending, and people have been pretending, and you think you're a good cook, and you tell everybody, try the meatloaf. My spouse loves it. And then people try the meatloaf, and they're shocked because it's not good. But you think you're good. It's not cute. It's not cute. It's not fun to not know that you have this gap, that you have this thing. Because you can deny it all you want, but people see. People in your life know. And so to pretend, at some point it goes from this self-deception that makes you feel good to then it segues into like the whispers and the how did she not know? And that's not great, right? You need somebody in your life, and sometimes it's one of the professionals in this room talking to someone to say, look, we need to just get real about this thing. And you may not like it, but let's see it as it is. So, reach into your folders there, and on the very back, on the right-hand side, there should be a piece of paper, blank paper. Pull that out, please. We're going to do a little exercise together. And there's like 2 or 3 pens floating around. So make 2 columns. And let's start on the left-hand column. I want you to write down 5 things that you like about yourself, your strengths, your talents, your assets, things that people in your life say are great, things that have done well for you in life. What do you like about you? What do you got going for you? Write down 5 things on the left-hand side. Please, for the sake of time, I hope that there are 50. But all right, now what I want you to do is write but, the big word B-U-T, right on the middle line. But, B-U-T. And now list off on the right-hand side 5 things you don't like about yourself, that you're insecure about, that you wish were different. What are your gaps? What do you want to get rid of or wish people didn't know? Please stop at 5 there. No, but you can peek at each other's homework. That's fine. All right. Now, for the sake of time, you see where we're going with this. What I want you to notice is that we often say this phrase in our heads. I am a smart woman, but I screwed up that thing the other day at work. I am really pretty, but I could lose 10 more pounds. Right? We say but. And I'll bet if you look at the things on the left and the things on the right, some of these things start to line up. Yes, but. There's strength, but this weakness. So now scratch out the but and write A-N-D, and. And this stupid little word, and again, cognitive restructuring, neurolinguistic reprogramming, there's all these fancy clinical words, but just saying and. It's that dialectic behavior therapy, if you're in the DBT. Let's honor that I am all these great things and I have these gaps or these things that I wish were different. But the things on the right don't undo the things on the left. We've got some runners in the room. If you ran 25 miles but walked the last mile, that doesn't mean you didn't run a marathon. But you can say that. I've only done a half marathon. I'm only half crazy. But the first time I did it, that's how I told the story. People were like, you did a half marathon, that's amazing. And people wanted to be excited for me and say, like, you did this great thing and pat me on the back. And I said, yeah, I mean, but it was slow, but I walked 2 miles of it, but it wasn't great. Like, dude, you went on your feet from here to there. That's amazing. It doesn't take away from it. So if we can say and, if we can appreciate, or if we can teach our patients to say and, then it honors the whole person. It gives you this more holistic self-assessment, which is, yeah, maybe I would like to nip or tuck or change or improve or whatever. But that doesn't mean that what I am or have isn't great as it is. We are perfectly imperfect, and that's what the message here is. Nobody's perfect. But as you are, you're great. Or you're good enough. And even if you want to settle for good enough, I'll take good enough. That's a start. At least that's better than what we usually say, which is something that's just negative and period, end of sentence, right? So the other part of the holistic, self-aware perspective we're trying to get to here is, do I need or want to change something? And there's a time for that. I mean, let's honor who's in the room and who's sponsoring us, right? Structure House, there's a time when you have a behavior that has gone too far and you want to correct. That doesn't mean that you're seeing a negative or undercutting yourself. That means that sometimes an honest self-assessment means I need to make this choice to eat better or make smarter choices. But it's the consciousness, right? How often, now here's the caveat, I'm not an eating disorder professional, so I'm not going to stray out of my lane here. But in terms of healthy behaviors, there's a difference between consciously saying, you know what, I'm full, I don't think I'm going to have dinner tonight, I really ate a big lunch, and I've already got my calories and I'm content. Consciously choosing that versus unconsciously having a drive to skip a meal, to restrict eating, or vice versa. Are you an emotional eater because you're unconscious of it, or can you say, you know what, I gave a really good speech to a room full of people tonight and I'm going to have a cake. And I am honoring it and I've earned it and I know what choice I'm making. So there is a time to make a change. I'm not saying that you look in the mirror and say, yep, all good, nothing needs to change. Like, that's a little silly too. But are you making a conscious, mindful choice there? And let's talk about food, okay? Again, recognizing that I am not an eating disorder professional, but I do a lot of work around healthy behaviors, behavioral reshaping about what are your patterns. I think being aware of your gaps, one of the gaps that we can all see, one of those, you call it a flaw, you call it a whatever, what are your triggers? What things set you off in a certain way? I'm very aware, because I've worked on myself and looked at myself hard, that I can't go to a bar with friends and watch a ball game and think that I'm going to eat something healthy. It's not going to happen. Or what I'll do is say, okay, I'm going to get the chicken wings, but no beer, no beer. But in my head I say, well, you have to have beer with chicken wings, and I've created this pattern, and immediately there it goes. If I go home to visit family in New Orleans, I have this plan. I mean, I'm down the weight and I'm in a healthy place and I'm eating quinoa and kale and I'm making smart choices about drinking 20 glasses of water a day and I'm getting my body moving. And I get there and immediately it's like king cake for breakfast and what's fried for dinner and nothing happens. And the gym clothes sit there and don't get used. And I immediately drop all my patterns and healthy habits because now I get triggered. And that was fine when I first moved away from home and went back and it was like, oh, I'm home from college or whatever. But I'm a grown man. I can't keep doing that. Again, not cute to come home and say, whoa, how did I gain this holiday weight? Why do I feel so cruddy from all the sodium? I know why. And it's silly to not know why. And that's a gap that I can't continue to pretend isn't there. Now, what I do about it, that's a separate, again, conscious, mindful choice. But the self-awareness, the self-assessment needs to take into account all those things, and sometimes it's not just a flaw or shortcoming in yourself, but it's in some behavior, it's in some pattern, it's something that you're missing, right? So, if you haven't heard it yet, what we're really talking about here too is that you're not one thing. You're not just the things in the left-hand column. You're not just the things in the right-hand column there. A holistic self-assessment needs to be multifaceted. I want you to see all the aspects of you. And what I think is important by doing this is that it's like spreading your bets. It's like, you know, hedging your bets, whatever the term is there, right? Like, I don't want to bet it all on one pony. I'm going to bet on a few. I don't want to buy only one stock. If the stock crashes on that, then everything goes to hell. I want to kind of spread it around so that way, if this is not feeling good on a certain day, if this, what was a strength or a positive today, is feeling like a real weakness or a gap tomorrow, well then I'm hanging it all on that. My whole self-image, all my self-esteem, everything is on this one thing. That's ludicrous. So I think about it like a bar graph. So we're going to use salt and pepper shakers as a bar graph because I was determined not to use PowerPoint slides and put you to sleep tonight. So if you can't see in the back, I've got a bunch of full salt and pepper shakers, or salt shakers, and there's a few that are low. So I've done this exercise myself, and we're all going to do it together in a minute. But I think if you picture your whole self, as this bar graph, and over here is maybe my professional character, maybe here's appearance, maybe here's finances, maybe here's exercise and wellness, spirituality, creativity, philanthropy, time with family. So I'm made up of all these different things. And on a given day, I can do a self-assessment and give just simple 0 to 10 ratings. But what it does is it shows you, whoa, this one's at a 2. And if I keep neglecting this or pretending I don't see it because it's a gap or it makes me uncomfortable, it's not going to fill up. It's not going to get any better. So I do a weekly or monthly self-check. And we can all do the same or teach our patients to do the same. Now, it takes some grounding and some finding your baseline, but with some honest self-care, I know that this month, this is my goal. I need to refill this salt shaker. I need to get that bar on my graph up. And this one's doing great. I can kind of neglect that, a little benign neglect, a little like, it's fine. Let it be. You're rocking. Leave that one alone. But if you keep ignoring this one, it might even go down more. So it's a moving target. And I think it's silly to pick just one thing to hang your hat on, but I also think it's silly to ignore something that, if you want to make that better, make it better, but put in the effort. See that that's the thing and try at that. When I used to, well, I still go to the gym, I don't know why I said that, but when I used to go to the gym more, let me say, I didn't like doing certain exercises. And it was very simply because I didn't look strong and manly or feel really powerful and fit when I did those exercises. Doing a pull-up is a very hard thing if you don't practice it. So I would skip the pull-ups. I would do the pull-down machine thingy. I would find all kind of workarounds, but like, no, how many pull-ups can you do? And I could be like, I don't do pull-ups. I mean, that's, and find some way to skip the, but dude, if you don't practice at pull-ups, you're not gonna get better at pull-ups. So it's facing the discomfort, it's sitting with the discomfort, right? This is some of the clinical stuff that we're dealing with, and saying, all right, do the thing that you're scared of or bad at, and then you might get better. That's the only way you're gonna get better, because you tried. So flip over your piece of paper, and you don't need to necessarily draw a graph or anything, but I at least want you to write out, pick a minimum of 5 things that make up your character, your person. What defines you? Is it intellect? Is it looks? Is it professionalism? Is it finances? Is it family? Is it moral character? Being philanthropic? Being creative? Being a giver? Being a good chef? Being a fast runner? What defines you? What do you care about? And that's what's key here. What do you care about? Not what should be on there. Okay, so now throw in some ratings. 0 to 10, how are you doing? Some ratings, 0 to 10 today. Are you at a 10 on those? Are you at a 2? Are you at a 7? How are you doing in each of those categories? We're doing a self-assessment here. So now you know what you like about you. You know what you value, but which is feeling a little bit low. And this is going to give you direction as to, do I need to make peace with some of those things that are low? Or do I need to put in the effort and make some conscious, mindful changes? Does anybody here know the serenity prayer? Some people call it the AA prayer, right? God grant me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. I think that's a great therapy technique, and I teach it to all my patients, because really, there's 2 columns that I hear there. Things that I'm struggling with that I need to accept, and things that I'm struggling with that I can and should be working on changing. Which category is it? I have had to accept my stature. I've even considered the lifts in the shoes and the thing. Not a cute look. No. This is what it is. I accept it. But what can I change? I can change how big I appear. If I told you how tall I am, most of you say, no, you're a little bit taller than that. I act a little bit taller than I am. And so my character lifts me up. Or I can dress with angles. I can change those things, but I have to accept I am as tall as I am. And so sometimes that's where these things fall too. So working on your lower salt shaker doesn't necessarily mean going out there and getting lifts in your shoes or doing more pull-ups or doing any of these things. Sometimes it's simply getting down to why am I struggling with that, and can I make that number go up through some self-work, some inner care. So back to the but versus and. So I'm going to say some apparent contradictions here, and I want to show you that if we say it as and instead of but, it just defines a person without needing to detract. For this, I need my slides. I am smart, arguably. I am a very good driver. I know this. And yet, I cannot read a road sign. My wife laughs that I really want the signs to say, Todd, turn here. Like, you know the roundabout? I can't do the roundabout. And if you pulled out a map and told me to point to a certain country, it's laughable how bad I am at geography. And, not but. I'm a good driver and I'm smart, and I don't know where countries are on a map. It doesn't take away from me being smart. I am a handsome man, not Joe Manganiello, but okay, I do okay. And I have great hair, if you hadn't noticed. All right? And I'm very short. And I am mistaken for a woman from the back sometimes. This does not take away from my handsomeness. But it's there. I'm a great doctor. I am a very good listener. And there are many days that I do not listen to what my wife says and fail all the things that I told my couples to do. I am very wise regarding health behaviors. I give lectures on it all the time, as you see. I know good diet and exercise, and yet I still make extreme food choices very often. As I said, New Orleans and chicken wings and things. And this one I found funny and didn't even realize until I started writing this speech, but I'm a great cook. Not a chef, but I'm a great cook. And I cannot boil an egg. Fact. Fact. These things, again, on the columns, the things in this column don't take away from this column if you say and. But if I had said any of those with a but, then you think, I mean, he's a great cook, but he can't boil an egg. And so like, it goes down. But why does it have to go down? One doesn't have to pull away from the other. They coexist. So let's talk about contradictions. In this holistic view of ourselves or our people or our patients or whatever, how can there be these things? Surely this has to take away from this, because I look at you or I look at me and these don't seem to go together. It's a contradiction. As a quote in one of my favorite books, which we can dispute later because I think it's a great book, but people think I'm silly for liking it. But the quote, nonetheless, is that there are no contradictions. If you think you see a contradiction, check your premises. And so premises or assumptions, misconceptions, that's what we're talking about here. So if you're looking at yourself or you're looking at somebody else and you're wondering, how can this be? This whole doesn't look like a whole. There's something that's missing or out of place. Well, let's consider a few factors. Number one, what's the setting? Can't we be different in different settings? I'm the same me, you're the same you, but if I plop you from here to here, I mean, vacation mode is the main thing that comes to mind, right? Wow, you never act like that on vacation unless you're on vacation. Yeah, because I'm on vacation mode. It's still me, but I'm in, Tahiti. Of course I'm not acting the same as when I'm in the office. But why don't we allow that or allow that in people? We see this contradiction and our brain kind of short circuits. And so when you think about the settings there, let's look at my contradictions, right? I am a great listener when I'm in the therapy chair, when I'm in the doctor chair, but when I'm in the sofa next to my wife, maybe not such a good listener. Different setting. I don't have the hat on. I'm not in doctor mode. Same guy. One doesn't take away from the other. But it's a contradiction. It doesn't seem to make sense. We also need to consider what's your mood state. Why don't we allow for that? Aren't we different if you're happy or sad or agitated? The holistic self-view honors that you have these gaps. Mine is road rage. How can I be such a nice guy? And then I get behind the wheel of the car and I get very, very. Different now with a kid in the car. My wife laughs. She's like, I can tell when the baby's in the back seat and when she's not, because But I'm in a different mood state. I'm in the car. I want to get somewhere. You're frustrating me. Now I'm annoyed. But I am not an angry guy. You would not define me as angry. If somebody was describing me, they wouldn't say he's a rageful guy. But now my mood has shifted, partly because the setting shifted, but partly my behavior shifts with the mood. Still the same guy. Doesn't change. We need to consider the relationship. I'm going to act differently around you than I do around you. The one that I find really fascinating here is when women come in and tell me that this guy is an X, Y, and Z expletive towards me, but he's a great father. And I love that because it seems like, well, that doesn't make sense. But yes, it does. Two different people, two different dynamics, two different relationships. It just is inconvenient because our brains want everything to fit into one nice little thing. But I'm different with this person than I am with this person. To combine a bunch of these, let's consider my favorite is always, I challenge people, you're the same. You're the same all the time, right? You're just you. And people will want to tell me that they're so proud that I'm me all the time, nothing changes. And I say, okay, so you're using some swear words with me right now. And they're like, yeah, that's how I talk. And I say, if your grandma was here, would you be talking like that? And everybody goes, no! Like, right. You're still you. You didn't give anything up, but you recognize the change in the setting, the change in the relationship. So that doesn't take away from you being you, a genuine you. We need to consider triggers. I hinted at this about the food, but this ties into so many different things as to what unconsciously, again, we need to make it mindful and conscious, but what's setting me off? Emotional eating is always the go-to, and in this crowd it makes sense, but that's the thing, right? How can I say, I'm going to just eat one bite of cake, and then I look down and I'm like, where did that cake go? How did that end up? Brain not on, cake in mouth. But I know better, and I just got done giving a speech to somebody about you should be conscious and eat each bite and taste it. But I got triggered because it was my favorite cake, or I was stressed, or I decided that that was what was going to fill me up. Or in my case, actually, it's that I waited too long to eat lunch, and now I'm rationalizing that, well, I mean, I need sugar. Before I came here, I ate a chocolate cookie this big. Because I said, well, I'm not going to get to eat dinner with the ladies, so I'm going to be up here. I need calories. I need calories. And I knew better, and I could have planned better if I had seen the gap and avoided the gap. So we're talking about owning your gaps, but it's also, you can almost picture like a gap and like, let's get around that gap. And lastly, I want to consider, oh no, I've got two more, priorities. Maybe you don't care. And maybe that's where there's contradiction in your behavior or yourself. This guy, I don't care where Latvia is on the map. Never been there, probably not going to go. I don't need to pass a geography test. So it's not a priority for me to learn where Latvia is. That's why I suck at geography. But I can tell you how to get from here to my house because that kind of geography is relevant to me. I care about that. That's in the want to or need to, but not in the I should column. That's a separate talk, want to, need to versus should. For the longest time, I used to have this contradiction until it kind of got pointed out to me brusquely. I've been living in Miami now for about 11 or 12 years, and not originally from here, and speak not a lick of Spanish. And so people partly look at me and think I speak Spanish, and I do not. And secondly, there's this like, but you should speak Spanish, or you do so much better in your job with Spanish, or you've lived here long enough, you should learn Spanish. And so for the first few years, I used to say, I want to learn Spanish. You know, I really want to learn Spanish. But then somebody would point out, well, dude, it's been like 6 years and you haven't learned, all you know is donde está la biblioteca, right? So check it. I don't want to learn Spanish. I want to know Spanish. I have no interest in learning Spanish. So my priority there is having the matrix thing, put it in my brain overnight, but I don't want to take a class and I don't want to fumble around. It's not a priority. I just tell my staff, si claro, to everything. And I think it works out. And I assume that they've done right by me, and hopefully it's going fine. It's not a priority. So that's why there's this contradiction. That's why it doesn't look like it makes sense. And last, let me say, and this is the biggest one, we make assumptions. We have limited data or limited contact with a person or limited awareness of ourselves. And so you're working based on this narrow view, and that's why what you're saying doesn't totally make sense. So the easiest one to pull from here is if you are in a crowded, dark restaurant and you see me from behind and I'm not wearing, I don't know, a shirt that says manly man or whatever that would be. This has happened to me wearing coats, but I guess women wear coats too. But you come in behind and you think, okay, person with hair like this stature, probably a woman. So people say ma'am. And I say, yes, what can I do? And I make sure you know, and I really embarrass you, and I get a free drink out of it. But there's an assumption based on the setting, based on the fact that you haven't heard me speak, based on people make assumptions, and that's where these little contradictions or misconceptions can happen. And we do that about ourselves. We have these assumptions that one day this thing will change, or that it's okay that I think of myself this way. Or we make assumptions about our patients and clients and friends and family. That we see something and we judge based on the external, on the behavior, and what we're missing out on is that there's more going on down here. So let's honor that. Let's appreciate the gaps. Let's love ourselves wholly. Thank you.